Welcome to the Gus Alva Perspective, a video cast that's earmarked to embrace and adopt the mindset of abundance and gratitude as opposed to the flip side of scarcity and fear. We oftentimes lock ourselves into mindsets that are harmful for us, and we can do much about changing that. Today's topic that I'd like to touch on is one called dual diagnosis. Did you know that individuals that have a neuropsychiatric condition, whether that be major depressive disorder, generalized anxiety, bipolar disorder, schizophrenia, or otherwise, sometimes run afoul with drugs? Or the flip side of that, sometimes individuals that have an underlying neuropsychiatric condition in their desire to feel better oftentimes end up utilizing um, behaviors that unfortunately are not going to help them out and actually create additional problems for them. Among that is the erroneous use of substances. Initially, it might be alcohol or weed, but then subsequently that migrates over to things like cocaine and meth and opiates, which lock individuals into a miserable existence where they become dependent on those very drugs that they thought might actually help correct the underlying problem. It's not an uncommon thing. Even if you think about, you know, the public at large, there's misconceptions in which people think, hey, if I'm having problems sleeping, I'm going to have a nightcap, and as a consequence of that, I'm going to be able to sleep pretty well. Not knowing, for the most part, that alcohol has a very short half-life, and as a consequence of that, people experience many withdrawal states throughout the night. And I don't know if you've ever experienced this, but if you imbibe with alcohol far too much throughout that night, you're going to have a horrible sleep because you're basically going through many withdrawals throughout the night. And so there's some ready explanations as to why certain behaviors are good ideas and others are not good ideas. But the important thing here is that, when we take a look at stigma and mental illness, it's really important to take into consideration that drug abuse and addiction are a very complex and challenging issue, and oftentimes require very effective interventions, which unfortunately are, for the most part, lacking at the present time. This is a very important topic because we basically note that a lot of our youth become enslaved to the utilization of different substances. And this is important because it robs individuals of their productivity and unfortunately then sets them at problems with the law. And so, we can't have a situation in which chaos reigns. We can't have anarchy rampant. But it's also important to address the fact that we need to be responsible about the education and the content that we present the public at large. Doctors, like myself, oftentimes can help out with prevention and education. This involves educating individuals, particularly the youth, about the dangers and consequences of drug use, providing them with the skills and the knowledge to resist peer pressure and make healthy choices. It's really sort of an interesting thing because I recall being a kid myself, being in junior high school, being in, again, a woodworking class. And then all of a sudden, the lights go out and they're showing us a film. And the film basically encompassed individuals overdosing and the consequence of the overdose related situations. Being introduced in that way to things like PCP or Angel's dust, a dissociative anesthetic, in which horror stories would abound, right? An individual maybe chewing off a body part of someone else without necessarily knowing so, or being struck multiple times without feeling anything, and then subsequently tearing articulations like their shoulder joint or otherwise, not necessarily feeling that until way later, right? Now, I'll tell you, when I saw that, that scared the dickens out of me to the point that I always thought, you know what, I'll never do drugs. And for someone like me, that was a phenomenal way of being able to avert any future drug use. So that scare tactic was actually a very important one for me. And I think that we now, at the present time, lack prevention and education programs like that. Now, the other important thing is an early identification or treatment. Now, which individuals might be more prone towards abusing substances, and through that, providing them with evidence based treatments that might improve their chances of recovery or reduce the harm associated with drug use. A very important tenet because sometimes individuals are trying to run away from specific problems that could have a very easy fix. And sometimes individuals are afforded medications that unfortunately have an addictive propensity that they're not necessarily aware of, and they become now enslaved to a given substance. So I'll give you an example. I oftentimes see particularly older individuals walking in and saying, "Hey, I need some Valium or I need some Xanax, and I've been taking this for years and years on end." And then you ask them, well, why is it exactly that you need this? You understand that, these are medications that belong to a family of medicines called benzodiazepines that will hurt your memory. That unfortunately, as we get older, there's a fat muscle ratio inversion, which means that medicines that like living in fat tend to store up in your system and might now build up and create more problems for you. These are medicines that are sedatives. That means they'll make you feel sleepy, and you could fall down as a consequence of that and injure yourself, particularly if you're driving and then you get pulled over. You could get arrested for driving under the influence. And it's amazing that oftentimes individuals are like struck by a thought, nobody's ever told me that. And so it's very important that we understand what exactly it is that we take, but also to be part of a decision making process. And so, as a psychiatrist, I oftentimes take the time to walk through my patients if there's the possibility of any type of addictive propensity to a medicine, that we address that at length. So, the important thing here is that we don't necessarily want somebody to be on a medication that subsequently creates more problems for them. So let me walk you through another scenario. Oftentimes individuals end up with an injury, sports injury or otherwise, and they all of a sudden get treated with an opioid medicine. Opioid receptors in the brain help you feel really good. Oftentimes there's an enormous surge of dopamine in the brain, which is a feel good neurotransmitter. And oftentimes that gets mediated through the opiate pathway. So, the individual that all of a sudden then starts abusing their medication to help control pain now becomes enslaved to a world of misery, because opioid addiction, which is another theme that we'll touch on later, is something that's affecting a lot of people at the present time. The interesting thing is that there are different types of medication assisted treatments that can help people overcome addiction to whether it be opioids or alcohol or other drugs. But this entails professional intervention and appropriate aid. Now, to be able to accomplish this, oftentimes we have to incorporate different types of behavioral therapies. Things like cognitive behavioral therapy or motivational interviewing and contingency management are very effective things that help with drug abuse and addiction. But it's really important to tackle both things at the same time. The individual that has an underlying neurodegenerative or neuro psychiatric condition should be being treated with inadequate medicine. Rather than being given a bandaid, they obviously should be getting something that's substantive without the addictive likelihood, and that might actually be more corrective. It's really an interesting thing because I'll oftentimes speak with patients and I'll say, look, if you had a laceration, if you had a wound where all of a sudden that cut was now split open, you would want to approximate the edges of that wound and then stitch it up so as to have appropriate granulation so that there would be good healing going on. Yes, we can staunch the blood flow with a band-aid, but we're not necessarily going to correct the problem well. And what we need to do is maybe utilize something short term that's going to help us get over the hump, but then subsequently address the underlying problem. Key critical issue, however, is that oftentimes individuals are seeking that quick aid, and sometimes they run into professionals that don't necessarily want to spend the time with them or think that maybe that band aid might actually be a sufficient aid for them. And that's unfortunately a bit of a disservice. So we also note that supportive services are certainly useful along the lines of, helping with individuals so they're not necessarily abusing drugs, and, that they're able to better recover from a fall that they've had. And by fall, I'm talking about a hiccup in which they've now gone about the faulty behaviors in abusing drugs. Community-based programs that engage individuals, families, communities, and speak about drug abuse prevention and treatment efforts certainly help out a lot. There's also another interesting thing, and that is drug courts. Drug courts are specialized courts that are, again, a way of trying to come up with a problem solving approach to address drug abuse. Now, how successful are these? Well, unfortunately, they're only as successful as the individual that wants to be getting the help they should be getting. The important thing, though, is that obviously there are different types of interventions, and these vary depending on the specific needs and circumstances of people. But a comprehensive, integrated approach is really the best way of trying to get to the core issue of reducing drug abuse and addiction, because this is something that is highly disabling in people. It's highly problematic. It's highly rampant and ties into different themes of what we've addressed in the past. There's certainly a great degree of it in, the homeless population that we see. There's certainly an abundance of it in, scenarios tied in with criminality. When you take a look at what happens with perpetrating a criminal act and then subsequently, at the bottom or at the underbelly of what's motivating that particular behavior is maybe the desire to actually get more of a substance that's going to keep people in a soporific state. That's going to keep them out of it and not necessarily productive. So it's important that we actually batter against misconceptions and mythology that exists out there. And among that, that individuals with underlying mental illness are all going to be addicted to drugs. That's not the case. But sometimes there are faulty behaviors that lead people down the wrong path. And as clinicians, as doctors, we need to educate individuals and the community better so as to be able to address these issues in a better manner and to have a corrective measure if we see a problem that arises. Like I said, there are very successful ways of being able to do this, and there are different types of resources that people can tap into, whether that be different groups, whether that be individuals that sponsor or become sponsees themselves, whether it be a living scenario in which it's free or devoid of different substances. A supportive community is always going to be very helpful, but also the underlying education tied in with different themes that might help us out a lot. Most recently, there was this State of the Union address by the most important individual in the country, the president. He was basically trying to address these very issues and the need that exists at the present time for further education, further information, particularly as it ties in with mental illness, but certainly also that intersection that exists between mental illness and substance abuse or dependence. Some sobering things to think about. I thank you for joining us in this segment of the Gus Alba Perspective. And keep in mind that a mindset of gratitude can help us along the lines of edifying our fellow men. Thank you very much for joining us.